A root cause analysis system to establish the most plausible explanation for post-endoscopy upper gastrointestinal cancer. Introduction. Upper gastrointestinal cancers, UGICs, are usually diagnosed by endoscopy. However, UGIC can be diagnosed after an endoscopy that did not identify the cancer. These are termed post-endoscopy UGICs, PEUGICs. The British Society of Gastroenterology recommends that PEUGIC should be a quality standard and regularly audited. In a meta-analysis, 11.3% of UGICs were not diagnosed at an endoscopy performed up to 3 years before the diagnosis, and more recent studies report PEUGIC rates of 6.7% to 9.4%. PEUGICs are less likely to present with alarm symptoms and are more commonly associated with less advanced clinical stage. Other associated factors include younger age, female sex, increasing deprivation, and an inadequate number of biopsies, but not endoscopist experience. However, the studies published to date have lacked a systematic analysis approach to the causes of PEUGIC. Colorectal cancer diagnosed following a colonoscopy that did not diagnose the colorectal cancer is termed post-colonoscopy colorectal cancer. The World Endoscopy Organization has proposed that post-colonoscopy colorectal cancer should be categorized into interval and non-interval cancers, and has provided a system to determine the most plausible etiologies. This was subsequently validated with suggestions made to improve the categorization system. The authors have undertaken a detailed analysis of PEUGICs to establish how many were interval and non-interval cancers, and have developed a root cause analysis system based on the World Endoscopy Organization post-colonoscopy colorectal cancer system to identify the most plausible explanations. Background. Missing UGIC at endoscopy may prevent curative treatment. The authors have developed a root cause analysis system for potentially missed UGICs at endoscopy to establish the most plausible explanations. Methods. The electronic records of patients with UGIC at 2 National Health Service providers were examined. PEUGICs were defined as UGICs diagnosed 6 to 36 months after an endoscopy that did not diagnose cancer. An algorithm based on the World Endoscopy Organization post-colonoscopy colorectal cancer algorithm was developed to categorize and identify potentially avoidable PEUGICs. Results. Of 1,327 UGICs studied, 6.7% were PEUGICs. Of the PEUGICs, 40% were diagnosed in patients with Barrett's esophagus. PEUGICs were categorized as Category A, lesion detected, adequate assessment and decision-making, but PEUGIC occurred. This happened in 16.9% of all cases. Category B, lesion detected, inadequate assessment or decision-making. This occurred in 34.8% of all cases. Category C, possible missed lesion, endoscopy and decision-making adequate. This occurred in 8.9% of all cases. Category D, possible missed lesion, endoscopy or decision-making inadequate. This occurred in 33.7% of all cases. Category E, deviated from management pathway but appropriate. This occurred in 5.6% of all cases. Category F, deviated inappropriately from management pathway. This happened in 3.4% of all cases. 71% of PEUGICs were potentially avoidable, and in 45% the cancer outcome could have been different if it had been diagnosed on the initial endoscopy. There was a negative correlation between endoscopists' mean annual number of endoscopies and the technically attributable PEUGIC rate. Conclusion. Missed opportunities to avoid PEUGIC were identified in 71% of cases. Root cause analysis can standardize future investigation of PEUGIC and guide quality improvement efforts.